The pelvic symptoms just didn't add up. The answer was completely outside of the pelvis. I had this patient, he happened to be a singer, and he had plateaued and his symptoms, they just wouldn't quit. We couldn't break through. I couldn't find the gateway to get in and actually address these symptoms. Once I finally found the answer for this guy, it blew my mind. Stick with me to the end of this video because it's gonna change how you treat these patients. My name is Dr. Chad Woodard. I'm a pelvic health specialist for a very long time. I'm the guy that patients come to see when other treatments don't work, when they plateau, and when they need help. So here was this patient. He came in, as all patients do, and he had this sequelae of symptoms: pelvic pain, some erectile issues, not quite what he wanted them to be, some urinary urgency, kind of the full textbook case. We had tried quite a bit. Right? As I do with all of my patients, we worked in the pelvis. That makes sense. That's where his symptoms were. If I dare say so, I'm fairly good at treating the pelvis. And I was doing everything I was taught to do, everything I knew to do, everything I'd learned to do. And we were doing soft tissue work and joint work and movement and breathing and on the list goes. And happily, frustratingly, this guy would soon during this treatment start to fall into a pattern. That pattern was we would do a treatment, he would get better, and then he would kind of regress back to a baseline. Now that baseline was better than he was when we started. There had been a slow and steady improvement, but if we really took a snapshot, was he where he wanted to be? No. Was he where he could be? I didn't believe so. We plateaued, and the plateau is a wake-up call. As a clinician, when I get a patient who's plateauing, that's a signal to me. That's what I pay attention to. The plateau is the signal, and I have to listen to that signal. The question nobody asks, when we get to that place of, it's just not getting any better, we have to trace things back. When our patients plateau, it's easy to say, well, it's not working because of this reason, that reason, or they're not doing this, or they're not following instructions, but we have to take a step back. Plateaus let us know. And what are these questions that nobody's asking? One of them, relevant to this case, is where else in the body could be presenting with something not optimal, not ideal, dysfunctional? What else is going on in the body that is causing a response, is causing a reaction, it's causing an adaptation? And I'll confess that's a it's a pretty overwhelming question as a clinician because it's a Pandora's box, isn't it? It could be anywhere, but that's the question that people don't ask. My patient's plateauing. Why? Why? So with this guy, we were chatting as we do, and I was attempting to take this big step back. Something's missing. I'm missing a piece. I just know it. And I'll be honest, he had gotten to a place where he was better. His pelvic symptoms were tolerable now. He was willing to tolerate them. They weren't gone, but tolerable. I don't know. The itchy perfectionist in me it struggles with the goal being tolerable. I want better. So we did a big zoom out. Okay, forest from the trees. Let's look at this whole system. The foot's connected to the thing and then connected to the thing. And up here is connected to the thing, right? So I started this process, and I'll be honest, nothing was working. It was maddening, right? I was like, oh, come on. I have to solve this puzzle. Anyhow, as I mentioned, this guy was a singer and he was working with a vocal coach. And he started talking to me about his diaphragm. I'm learning these exercises, Dr. Chad. I'm learning to breathe with my diaphragm. Oh, it's really helping my singing. Oh, it's so great. I myself am a singer. So this guy was super excited to talk to me about this diaphragm thing and breathing exercises and what we're doing here. Could it help somehow? And passionately, he was fixated on a diaphragm. And I took that as two things. Number one, good, because he's fixated on something that wasn't his pelvic pain. That to me as a clinician says, aha, that pelvic pain that was a catastrophic, must be solved situation now is, well, it's still there. But all of a sudden, this diaphragm thing was more interesting to him. As a clinician, I'm happy with that. That means we have made good progress. So diaphragm. He was so excited about breathing. So I thought, okay, all right, fine. Let me just check to see what the diaphragm's doing. And we checked the diaphragm and okay, we found some things. I did some manual work and it helped. Oh no, that made things much worse. Now he was really obsessed with the diaphragm because I'd done something that made it feel better. But again, plateaued. His pelvic symptoms had stayed. His diaphragm and breathing gotten better, but now he was fixated. So I thought back, all right, let me check to see what's going on in this guy's neck. Diaphragm is innervated by a nerve coming from the neck. The neck is called the phrenic nerve, and it comes out of C3, 4, and 5. Now, my clinicians watching this will know that. Uh, my patients or my non-clinicians watching this, yeah, you breathe by a nerve that comes out of your neck. I explained the anatomy to this guy. Here's the nerve, comes out of the neck, innervates the diaphragm. Maybe if that nerve is not transmitting signal, super efficiently, somehow, maybe that's affecting the diaphragm. Let's check it out. Oh, he was off to the races. He was so excited. So I went and I checked that part of the neck. And guys, I found nothing. Nothing. Oh, and I was like, man, come on, let me find something. I didn't find anything at C345, the area where the phrenic nerve originates. While I was there, I just did a little biomechanical screen of the entire cervical spine. And while I did not find anything at C3, 4, or 5, I did find something at one level above, C2, 3. Is this related to the pelvic floor symptoms? That was a big question. Is this related? Why has he been plateauing? Why have we been stuck? Now, I'll confess, I didn't have a lot of clinical reasoning as to why I did this, other than I found something that didn't feel ideal. I decided, treat it. Is there a cause and effect? Is this thing that I found at C23, could it be driving the symptoms in the pelvic floor, that plateau? I don't know. I was sure, whatever. Treat the C23. So I did. I treated C23 and I got it and I safely screened it and then I did a manipulation with his consent. Sorry, I got chills again. I love what I do and I am such a dork about it. The next visit, this guy came in and here's what happened. I said, so, how are we doing? He's like, oh, Chad, my breathing, my vocal coach, he can't believe how much better I'm breathing. And whatever that thing you did in my neck, boy, that really did it. The clinician in me, I celebrated his win. I don't care about his breathing. I'm not here to make him a better singer necessarily. Primarily, I wanted to help him with this pelvic floor thing. So I said, oh man, I'm thrilled. So glad you're better at singing and breathing. Just a quick follow-up question. Can I ask, how about your pelvic floor? And it surprised him. It took him a beat. He was like, uh, it's weird. I haven't even thought about my pelvic floor this week. Chills again. Holy sh! Can we pause everything? Stop the train, pull the lever. Did you just tell me that you haven't thought about your pelvic floor all week? Yeah. And I said, oh boy. Okay. Does that mean that you haven't had symptoms that registered enough? That the symptoms got so good that they haven't even surfaced to your awareness? And yes, that is what that meant. But for me as a clinician, man, I was thrilled. I was confused. Why did a C23 grade 5 manip fix this pelvic floor, break through that plateau. As a clinician, I had more questions than I had answers. Now, the neurology, the reasoning, the biomechanics, the answer to that is astounding. Like the body is cool. And I think for this video, going into that deep neurological explanation, evolutionarily, hierarchy, all these nerdy words of why that segment in his spine did something directly to his breathing and to his pelvic floor is far out. The longer I do this and the more knowledge I get, the more astounded I am at how outrageously cool the body is. What is the lesson that I learned here? The cause of someone's dysfunction, especially if they are plateauing, is often not where the symptoms are. In fact, it can be about as geographically far away from the symptoms as you can possibly get in the human body. It's a big take home for me as a clinician and for those I mentor. The way to get in, the way to access this nervous system, the way to truly address these symptoms is to find what's driving them. Now, what's driving them biomechanically can be close, neurologically can be anywhere in the body. And it's asking that question. It's getting to that plateau and being signaled. Woo, plateau, stop. Let's look, let's explore, let's reason, let's hope, let's Hail Mary, but it's far sometimes. And as a clinician, that's really important. Clinicians, this is what clinical reasoning looks like, tracing something back, having the vulnerability to ask, what am I missing? For my patients out there, if your unexplained symptoms or your symptoms that just won't quit have been with you for a while, it could be because, like this guy, your actual driving dysfunction is quite far away from the thing that hurts or doesn't move or work the way that you want it to move or work. So, patients, if this is your story, if you heard yourself or a version of yourself in this story, stay with me. I'll keep producing and sharing and educating to help you directly. Clinicians, if you heard this story and you say, "Woo, I have a caseload of people like this," I've created a free video that unlocks the 3 big reasons, the 3 big secrets that I was missing that took me a long time to find out, that I lay out the big primary misses, the big primary learnings I've had. And I would invite you to watch that video to continue your learning, to continue your progress, to start answering, to start asking the right questions.